Dissection safety is very important. You must know the tools you're working with and how to use them. The first and probably most dangerous tool is the scalpel. The scalpel is a sharp blade used for making small incisions into the specimen. Do not make a sawing motion or stab people. The scissors are used for longer cuts and removing flesh. The tweezers are also used to carefully move small organs and intestines or hold back skin. Make sure to always wear gloves because you never know what diseases your specimen may be carrying. After your dissection, always make sure to clean up your lab station. First, we shall look at the external anatomy of the pig. Make sure to lay your pig with the anterior side, belly side, facing upward. Note the thin peeling layer of tissue covering the body of your pig. This layer is the epitrachum, a layer of embryonic skin that peels off as hair develops beneath it. Also make sure to tie down the appendages. The umbilical cord is a tube that connects the mother to its fetus and supplies nutrients. The thoracic cage protects all the pig's vital organs. You will need to cut through this carefully to get to the inside. In order to determine the sex of your pig, you must look for these things. For a female, look for a single urogenital opening just ventral to the anus. A prominent genital papilla projects from the urogenital opening. For a male, look for the scrotum, a sac-like swelling containing the testes and located ventral to the anus. The male urogenital opening is faintly visible just posterior to the umbilicus. Note that males as well as females have multiple nipples. And now the muscular system. You'll be able to examine the muscular system without making any major incisions. Firstly, just make a small incision with your scalpel and finish it off with your scissors. Then peel back the epiphyseum to reveal the muscular tissue. The muscular tissue in the leg is thick and fibery. This is because it is striated muscle tissue. There are three types of muscular tissue in the body: striated, smooth, and cardiac. Striated is any voluntary muscle, smooth is any involuntary muscle, and cardiac is any muscle to deal with your heart. In this leg, the muscle we are looking at is called the gastrocnemius. Muscles are responsible for movement and stability. Showdown on the very similar to the skeletal system of a human. In both a fetal pig and a human, their bones are held together by cartilage, ligaments, and muscles. Both humans and pigs have ulna and radius bones, a lot of similar skulls, patellas, ribs, scapulas, humerus, many vertebrae, femurs, tibias, and fibulas, just to name a few. Adult pigs have 44 teeth, and humans, who also have teeth, only have 32. But humans have 2 sets of teeth. Adult pigs have 216 bones, compared to the human, who has 206, but at birth have between 300 to 350. The function of bone serves to give support to the pig and provides points where skeletal muscles can attach. The skeletal system of a pig also serves protection against injury of internal organs such as the brain and lungs. The structure of bones within the pig are made of hard shell known as compact bones, and is surrounded by cartilage. Inside the hard shell is a spongy bone, bone marrow, blood vessels, medullary cavity, periosteum, and endosteum. Bones of the fetal pig are located throughout the body to serve structure and support movement of the pig. The circulatory system in both pigs and humans consists of the heart, veins, arteries, and capillaries, all of which circulate blood throughout the body. Deoxygenated blood is pumped through the right atrium of the heart to the lungs, where it becomes oxygenated, where it is pumped back through the systematic tract back to the heart and pumped out the left atrium, which is much bigger than the right, to the rest of the body. Arteries carry blood away from the heart, and veins carry blood towards the heart. The lungs are the focal point of the respiratory system.
As seen here, they are those large flaps coming off the side of the heart. Lungs are responsible for taking in the oxygen-rich air brought in through the nose and mouth and using that to oxygenate the blood being pumped through the lungs by the heart.
Pigs are monogastric, which means they only have one stomach. Digestion occurs along the digestive tract. It starts in the mouth where the food is ground down by the teeth and softened by saliva, so it can slide down the esophagus more easily. The esophagus is a tube that leads from the throat to the stomach. In the stomach, the food is broken down by enzymes and some nutrients are absorbed. Then the food makes its way into the small intestine where it is broken down even more, and all nutrients are absorbed with help from the liver and pancreas. Lastly, the food enters the large intestine where the waste material makes up feces, which is then passed through the anus.
All reality is 6 feet deep. It's survival of the fittest from the cradle to the grave. The temperature's rising, so I drink away the pain.
Urine is formed by the kidneys. It contains the nitrogenous wastes, ions, drugs, and other materials filtered from the blood by the kidneys. The two ureters are hollow tubes that exit the two kidneys. Urine passes through the ureters to reach the urinary bladder for storage. Urine is stored in the urinary bladder until the mammal eliminates this fluid waste through urination. Urine exits the bladder to the outside through the urethra.